Alright, so you've watched the video on interview tips and how to stand out. In this video, we're going to talk specifically about behavioral questions that you may be required to answer. I'm going to teach you a strategy called the Start Positive strategy, and we're going to dive into that right after this. Alright, so the first thing we need to know is, what is a behavioral question? Essentially, behavioral questions are analyzing your response to various situations. It can be if you're adaptable, how do you manage conflict, what is your prioritization thought process. They're looking for your action and responses so they can test your aptitude and experience to see if you're a good fit for this job. So before we get started with how to solve a behavioral type question, I want to give you some tips. And the first tip is to bring pen and paper. When you go to an interview, writing down little details about that question helps you to plan and think about it before you answer. When it comes to organizing your approach, there are a few things to consider. First is your nursing process. Remember the assessment, diagnosis, planning, implementation, and evaluation. You don't want to tell them you'd evaluate if you haven't already assessed. So you want to put those into perspective. The next is the ABCs of life: airway, breathing, circulation. If you get a question that's asking you about prioritizing, that's your second go-to strategy. The third one is resources. Remember, you are not an island. And if you are an island, I'd be a little concerned. You have resources available to you. So for example, you get a question about a blood sugar that's 2.9, what do you do? Now maybe you've never worked with a low blood sugar. Maybe you've not worked in this facility and you don't know their policy. That's okay. But you do have some knowledge you can draw on. You can talk about how you recognize it's low. And if you don't know this facility's policies or procedures, that's a resource you would tap into. You would search the resources. You would look up the policy. You might talk to the nurse educator. But from what you recall, it needs to be treated with some glucose fairly quickly if they're symptomatic. And the last tip is to tell a story in your answers. And this is where the Start Positive model comes in. S stands for situation. What was going on? Who was involved? And why did it matter? T is for task. What was your role in the situation? A is action. What did you do? R is response. What happened after you acted? Whether it's good or bad. And then T is your takeaway. And positive is to remind you your takeaway needs to be in a positive direction. So if the outcome of this event was not positive by your standards, maybe you failed to communicate clearly, the patient fell on the floor, whatever happened as a result, you still give your takeaway. Well, I learned that. With that particular person, I needed to communicate directly and not be suggestive. What was your takeaway? So with that, let's get started into some of the common types of questions you can prepare for. Because communication is the #1 skill, you can guarantee you will have a variety of questions that will touch on communication. They often come in the form of conflict, but you may also get a positive question. So some samples might be, tell me a time when you had conflict with a coworker and how you managed that. Or how would you deal with the boss who's asking you to do something that is not in your scope of practice? Or maybe even, how would you handle a rude coworker? Potentially a patient's family that was unhappy with your care. A lot of ways that communication and conflict will show up. Using the START methodology, I'm going to give you an example. In this scenario, we've identified a practice issue in another colleague. So my situation, S, is I was working with a coworker who wasn't properly documenting ins and outs on their sheet. This was important because the patient was on strict in and outs for their kidney failure. What was my task? My task was I was covering for her, and I went to document the fluids that I had hung, and I realized there were no other documented intakes. What was my action? I talked to the nurse and I asked her to explain to me where she was capturing her ins and outs so that I could make sure my input was available to her. The result was she didn't document her ins and outs. In fact, she thought by simply signing it off on the MAR that it was captured as intake and output. So some education took place, and it took a little while for her to realize her error in missing that documentation. But by the end of the shift, she did come to me and she recognized that by not putting those fluids on the intake sheet, they actually were not being captured in the daily total. So the takeaway for me was that even though my process was following the process of the hospital, I wanted to understand what she was doing, because maybe she had a different strategy, before I passed judgment, before I provided education, before I asked her if she could follow policy. I didn't need to report her to the charge nurse. I just needed to understand her methodology. I found a gap and an opportunity to educate for best patient outcomes. You see how that works? Now you could do that for any questions. So let's look at some other questions you might find. All right, so some other questions you may find that you can prepare ahead of time are, tell me about a time you had stressful work or a stressful work environment, and how did you handle that? Again, don't forget to tell a story and use the START Positive system. How do you handle failure? Or tell me about a time when you tried something and you were not successful. Collaboration questions. Tell me about a time when you did not get along with your coworker. How did you resolve the issue? Teamwork. How would you respond to the charge nurse if she asked you to take care of some work that was already assigned to another nurse, not on your workload? Achievement. Tell me about a time when you achieved something you're really proud of. What did that look like? Patient care. Tell me about a time when the patient's family was satisfied with the care you gave. And on the opposite side, about a time when the patient's family was not happy. They were dissatisfied with your care. And how did you manage that? Crisis management, adaptability. Talk about a time when your past employment or in your past clinical, a change was introduced on the floor, such as a new policy. How did you adapt to that new change? Another question could be, tell me about a time when you did not know something at work. What did you do? Time management. That is so critical in nursing. We have multiple things to do and no time to do it. So you may see that there's a question that says, when you work in a fast-paced setting, how did you prioritize your tasks while maintaining patient care? That's a double whammy. They're looking for prioritization, time management, and patient safety. So there you have it. Let's do a quick summary. First thing you want to do is bring pen and paper so you can write down details of those questions. Then you want to consider the nursing process, your ABCs of life, and the resources that you would use and collaborate with to get to that patient outcome. And then the last thing is to implement the START Positive strategy so that you can tell a story, give them a little bit more insight into your thought process, your knowledge, your experience, and how it positively impacted you and will continue to impact you going forward. So there you go. Take some time now and plan some of your answers. You do not have to always draw on nursing experiences. If you've done customer service jobs in any field, you have certainly probably dealt with conflict, communication, prioritization, delegation, stressful work environments. Look for those key situations that you can mold and show how that growth will apply to your job as a nurse. I hope this has been helpful. If you have liked it, give me a thumbs up. Comment below in the section and tell us what you have found in interviews and some strategies you use to be successful.